Now I'm going to be doing some fracture testing of the lower limb. Okay. First is called the bump test. Okay. You'll have a patient here. What you'll do is kind of grab their forefoot, not very tightly, but just kind of, you got it. Okay. And what you're going to do is kind of get the heel of your hand and hit. And what you want is that force to go up the leg. Okay. Most of the time, if you've got a fracture, you'll feel it in the tibia, okay, but they might have a pain in the fibula as well. But that's not a direct yes. He's got a fracture, but you can add it to your evaluation. So here, heel of your hand hitting up like that. Okay. Another test, and it's really not a test. It's just kind of knowing your anatomy. Okay. And what you're going to be running your finger along the fibular bone, okay? And so anytime you're straight on the bone when they have pain, then most of the time that kind of indicates, hey, let's get an X-ray of the bone, okay? Same thing with your tibia. Tibia is that peak, kind of close to that skin part of the medial side of your lower leg, and you just run your finger all along that. You got to be careful with shin splints, but if they're real painful on that bone, that indicates let's go get an X-ray. Okay. Another way of testing the fracture of the fibula, if it's proximal, not distal, proximal, is you just get here and kind of squeeze that up top there. Probably 90% of the time you won't have it, but you gotta take in consideration that 10%. So just here, getting that where that fibular head is, you squeeze it. No pain, yes pain, indicate no X-ray or X-ray. Okay. All right, for the forefoot, what you're looking for, they could have a fracture in some of these long bones here. Okay. And what you're gonna do is you're gonna just kind of grab around. Okay. And you're just going to squeeze it all together. Okay, that's going to be very painful if they've got a fracture going on. Okay, so you just kind of grab around, squeeze firmly. Okay, I'm not looking to crush the foot, but it's going to be firm. Okay, and you're squeezing the arch. That could also indicate it's also where your anatomy is as well. Wherever they're painful, if it's along the bone, X-ray indicates. If it's in between, we might be just dealing with a sprain. So something to consider that. Okay. Last one is if they've got a fracture of any of these phalanges, and what you'll do is you can take this and hit along there. Okay. You want to try and keep everything nice and in line. Okay. You don't really, if it's off to the side, that's going to dissipate the force, which is what you don't want. You want it to keep riding all along those long bones. Okay, so you'll take this and you just flick it. This is the exact same concept as the bump test, but we're dealing with smaller things. So you're just hitting here. What you're trying to do is get that force to go into the bone. And if it is fractured, it's going to vibrate and cause a lot of pain, or they're just going to be mild or nothing at all. So those are a bunch of tests for fractures in the lower limb.